This meeting is being recorded.
Hello, everyone. This is Dr. Siddharth Amber. Welcome to our webinar today. As we begin, if there's anyone who's having difficulty with audio and video, please let us know, but otherwise we'll go ahead and get started today. So today we're talking about our peptide therapy for weight loss program. It's a little bit about who I am. My name is Siddharth Amber, physician here at Chicago Arthritis and Regenerative Medicine. We specialize in non-surgical management of arthritis, tendonitis, injuries, and back pain, as well as metabolic health. A lot of our patients benefit from weight loss. We've started to involve peptide therapy for weight loss for our patients, helping for not only weight loss, helping for inflammation, helping for a lot of pain issues, in particular for lower back, lower extremity arthritis issues as well. So in today's talk, we're going to talk about our signature weight loss program, as well as some newer peptide options that you may want to consider as well. Actually, just before I go on, let me just confirm. Okay, good. So, let's talk about the scope of our problem that we're trying to handle here. Obesity, global concern, has really a profound impact on quite a few different areas of the body, including cardiovascular health, metabolic health, which means like your blood sugar, blood pressure, everything that comes from that, which is actually pretty vast. Your immunologic health, it does increase the rates of various autoimmune issues and well-being as well. So this is a global epidemic affecting really a significant number of people throughout the world, and certainly a large number of people in our country here in the United States as well. So today we're talking about our physician-assisted program to help people handle this in a safe and effective way. So when it comes to health effects of obesity, there's a lot of different things. Certainly what I see a ton of is or are a lot of musculoskeletal problems in terms of arthritis and pains in the knees, the hips, the ankles, and the lower back. Certainly cardiovascular issues when it comes to type 2 diabetes, when it comes to high blood pressure, heart disease, things of that nature. And then, of course, metabolic issues as well in terms of type 2 diabetes, insulin resistance, again, high blood pressure. Metabolic health affects so many other things, whether we're talking about immunology issues in terms of higher risk of infections or worsening certain autoimmune conditions like psoriasis and psoriatic arthritis. But that metabolic health, as it gets thrown off, it increases the risk of various cancers as well. It also increases the risk of certain neurodegenerative issues, even things like Alzheimer's, some evidence of that as well. So this metabolic health issue is pretty profound, and we really need better options for handling obesity issues because of the significant long-term risk, because our current options are limited. And by current options, I'm talking about traditional options such as diet and exercise. They can work, but they're really not adequate for many people. Conventional weight loss strategies are helpful, but they tend to have a limited or unsustainable result, and it tends to give people kind of a yo effect, which is very problematic. And a lot of people tend to have difficulty maintaining weight loss due to a number of reasons, including biological, psychological, and environmental factors. I think some of our newer peptide options help out in all those regard. So our goals of treatment are as follows. Besides weight loss, it's also how do we improve body composition? How do we reduce fat but maintain muscle mass? That's very important. How do we reduce visceral fat? Visceral fat is important because that seems to be the fat that is actually more connected with metabolic problems and cardiovascular problems. We also want to improve your cardiovascular risk factors. We want to improve your metabolic risk factors. We want to improve your exercise capacity, eating habits, improve your immune health, your gut health, and improve sleep and stress management as well. So there's really three ways that diet can help you with weight loss. The first is that you can just eat less calories. That means less intake versus how much you're putting out in terms of exerting will lead to weight loss every time. Number two is eat less of specific foods. So in the past, it's a straightforward thing, but over time, it's become a little bit more complicated. When you look at what things the general public considers appropriate for weight loss, you have everything from people who are hardcore vegans to people who are hardcore carnivores. When you look at most medical associations, for Americans, they tend to recommend more of a Mediterranean style diet, meaning one that tends to be lower in red meat, higher in lean meats, lower in foods, lower in high sugar foods, higher in vegetables, higher in whole foods as well. I think that's a good general recommendation in large part because it works for most people. It tends to be more moderate and probably is a good option for most Americans as well. And the other aspect of food or diet is also intermittent fasting, eating during certain specific periods of time. So intermittent fasting is this concept that you don't eat for 16 hours. So the most common one, and then you eat for 8 hours, or you have the option of eating for 8 hours. So the most common one is your first meal starting at 10 a.m., your last meal ending at 6 p.m. Probably a good idea, seems to help with various metabolic risk factors when they look at measures of outcomes. And so probably a good option for a lot of us to consider as well. So peptides are a really innovative therapeutic tool that have been around now for the last several years. Peptides are naturally occurring molecules in your body that they act as signaling molecules in the body. And what that means is that they are basically proteins in your cells. So we use peptides in your body and produce peptides that are probably therapeutically bad. And it's not only medicine, it's what now. So the peptide that's really kind of changed a lot of things right now are the GLP-1 agonists. So GLP-1 or glucagon-like peptide 1 is a naturally occurring hormone that comes from your gut that regulates your appetite, your insulin secretion, and energy metabolism. There are other similar peptide targets that are already being targeted. That includes your GIP and your GCG. You can see these in options that are available right now. Semaglutide and tirzepatide are the ones that are available right now. Retatrutide should be coming out or is on the verge of coming out. These have a key role in your overall blood sugar control and insulin secretion, and they regulate your blood sugar levels by stimulating insulin and by getting your blood sugar to get pushed into the muscles a little bit faster. So very key role in blood glucose and this diabetes management, and thus also metabolic health. So potential game changer when it comes to weight loss in the following way. So this was originally approved, semaglutide was originally approved for diabetes. What they found was that diabetic patients were losing really 15 to 20% of their weight as they were taking these treatments. They then checked this in the general population, people who are not diabetic, and they found similar effects. So the GLP-1 agonists work because they improve your blood sugar control. They reduce how fast food gets processed through your gut, and they reduce your overall appetite. They reduce the chemicals that seem to make you more hungry, and they increase the chemicals that make you feel more satisfied. So the other way to think about it is that they reduce your food chatter, that sense that you need to eat. And what's amazing is that this works on a metabolic level in terms of how your body processes sugar. It works on a processing digestion level in terms of how your gut is handling it, and it works on a brain level so that you're not as hungry as well. And so it really works in a fairly all-encompassing way when it comes to food consumption and thus diet as well. So semaglutide and tirzepatide are the two ones that we're talking about today. These are FDA approved for type 2 diabetes and chronic weight management in adults. The chronic weight management in adults is interesting because it's approved for folks with a BMI of over 30, also approved for people who have a BMI of greater than 27 who also have one other weight-related comorbid condition. That can include things like high blood pressure, diabetes, cholesterol, wear and tear arthritis, fatty liver, prediabetes, heartburn, PCOS, hypogonadism, and asthma. So really approved for pretty wide spectrum of ways that we can help people out. Other potential future preventative indications could be including the following: metabolic syndrome, anti-aging, neurodegenerative diseases like Alzheimer's. There's actually some evidence that it seems to slow or prevent the progression to Alzheimer's. If you've already had prediabetes, preventing the progression to diabetes, or if you're at risk for prediabetes, even preventing that progression, and possibly preventing the progression to cardiovascular disease as well in people who have, let's say, a family history of that risk as well. So the way peptides work is as follows. You're essentially dosed once per week. You inject yourself. The keys here are that you start on a low dose, and then you slowly escalate as tolerated and as needed. We'll keep an eye on your weight, your appetite, observe for any side effects on a monthly basis, and monitor your metabolic health labs every 6 months or so. Make sure that they are appropriate, working, not causing any side effects as well. So when you look at the clinical trial data for these treatments, you find treatments that are low risk in terms of toxicity or potential problems, and you find treatments that work fairly consistent. On average, you'll find that semaglutide, that's the other name for that is Ozempic, but semaglutide is the generic name, will give on average 15% weight loss. Tirzepatide gives about 20% weight loss. What's exciting about this is that this is fairly consistent in terms of how well it works with a lower risk profile compared to any of the other prior weight loss treatments we've had in the past. So not only a very reliable treatment for weight loss, but the most common side effects tend to be GI. Usually for most people, it can be some nausea, some fatigue. The keys here are to start at a very low dose and then slowly increase. As you slowly increase, as long as you're tolerating it and as long as it's working, you're okay to continue. But if there comes a point where maybe you're not tolerating it as well, pausing or reducing the dosage is possible as well. Lipotropics are the other type of treatment that we want to talk about for weight loss here. These are substances that help to break down fat and help to metabolize fat in the body. These are a collection of certain vitamins and supplements and amino acids that are listed there. Their benefits are they can improve your energy level, help with liver detoxification, aid in weight loss, overall good for your immunity, hormone health, joint health as well. Very low risk, helpful option for a lot of our patients. This is a intramuscular injection that you give yourself once per week. If you combine this with peptides, you can get an even better degree of weight loss. The way lipotropics work is that they help to mobilize fat from your adipose tissue. They help your liver function better to metabolize fat, overall support your liver better as well, and even help to convert your cholesterol into a healthier version in the liver as well. Another aspect I think is helpful is health coaching. There's this concept that if you are trying to develop a new habit, let's say changing your dietary habits, that a new habit can take 60 to 90 days of consistent daily sort of focus to get it done correctly. Health coaching can be useful in that it can help with not only education, it can help with accountability, it helps you maintain to get to that healthy new habit as well. Nice option to help you on your weight loss path as well, one that we can help to offer as well. The keys to optimized treatment are really the following. Peptides and lipotropics work great. Combine that with regular exercise and nutrition will help with the most with weight loss. Nutrition is key here in that you want to eat nutrient-dense food. You want to avoid overeating. These kind of treatments will generally prevent you from overeating, but you want to make sure you're eating food that is still healthy and good for you so that you're not filling up with things that are not really feeding you properly. And then there's exercise. You need to do not only cardiovascular exercise to assist with weight loss and improve your metabolic health, but strength training regularly to help protect muscle loss is important as well. There are other peptides that are available now as well. The ones that are currently available tend to work more on the growth hormone axis. They're interesting because they can help with weight loss, help with muscle strengthening as well, help with overall sort of body composition as well. It's another option that is slowly progressively becoming available that is interesting to consider also. The keys with all these peptides are to think safety first. And that means that if used under appropriate medical supervision, These are low-risk options. When it comes to potential issues, here are the things that you should know about. Number one is injection site reactions are rare, but anytime you inject yourself, there's a chance for a reaction to that. Number two is your blood sugar is going to be moderated, so you just have to keep an eye on that and make sure that it's not dropping it too much. Next is GI side effects like nausea can occur. Rarely things like fluid retention, headaches can occur as well. The keys here are to start low dose, and slowly escalate as tolerated and as needed. So when it comes to safety, here's other things. So the GLP-1 agonist, there's really great data. Some of these other peptides that I mentioned, the growth hormone ones, much less published evidence. They do have positive physician experience. I recommend for all these treatments, be cautious. If you already have any other kind of active medical issues, you may still benefit from these treatments, but just make sure your physician is experienced and knowledgeable and knows what they're doing, knows how to handle this. If you do have other medical issues as well, it can be done safely. You just have to make sure your physician is experienced with this. Also be aware that in some cases, dosing cycles, not so much with the GLP-1 agonist, but some of the growth hormone agonist ones, you do need to take a break every so often to let your body reset, to do this safely and properly as well. Combining peptides is an interesting idea, one that I think is still fairly new, but the idea of combining, let's say, GLP-1 peptide with one of the growth hormone peptides to get not only a better weight loss effect, but also body composition effect. I think if you combine that with healthy nutrition and regular exercise, can be very helpful. And keep in mind, this is not a quick fix. This is a slow, progressive improvement over time. You should work with, again, experienced and knowledgeable physicians to guide you through this appropriately. Here's some things that you should know from a regulatory standpoint. For anything that we do medically, the FDA is generally involved. And so the FDA does have guidance or rules that will change over time. To get these treatments, you can either get them through your typical kind of medical pharma company. Unfortunately, insurance is not typically covering this for weight loss or some of these other metabolic indications besides diabetes, which is where compound pharmacies have come into play. Compound pharmacies are able to make generic versions of these. If you work with a reputable one, they can be safe and appropriate to use. Understand that this is a regulatory area that is in dynamic flux, and that if the FDA says that compound pharmacies cannot use this any longer, you need to work with your physician to figure out other options to continue with your weight loss journey. Your physician has to be not necessarily an expert in FDA regulations, but they need to be aware so that they can get you through this safely and appropriately. So something you may hear about from time to time is what happens if you lose access to your peptide therapy. There's a few different options. Let's say you're taking tirzepatide. You may not be able to get that to your compounder sometimes. You may need to get this directly through the brand name, such as Mounjaro or Zepbound, right? Those are available. Sometimes the pharma companies will have discounted pricing if you have to pay for this out of pocket. If you're lucky, maybe your insurance covers it, in which case maybe you're on track, but that's pretty rare. The other thing is to consider changing to another peptide or peptide combination. There are various other options that you may still be able to utilize that are not regulated or that are not banned by compounders. And then, of course, just remain patient. Sometimes your peptide may come back online. The FDA has changed the rules on this in the past. And, if you're aware, if the physician is aware of what's going on, they can, again, guide you through this safely and appropriately. So if you start a peptide, how long before you start to see weight loss? Understand that most patients will notice some early weight loss in the first month or so, but really there's a slow buildup phase, starting on a low dose, increasing it. And so you want to start, trying this for at least the first 3 to 6 months, because your body needs to slowly activate to this treatment. Again, you start on the low dose and you slowly escalate. How much can you expect to lose on average with the GLP-1 agonist? 15 to 20% body weight over a year to 2 years is realistic. How long do you need to continue treatment? Again, I recommend initially at least 6 months to see how well it's working. The peptides, the studies out there show that these are most effective for chronic weight loss. So you're not just on this for a month or two and then you're off. This is really something that you're taking longer term. A lower maintenance dose is possible. That can mean either lower dosage or frequency of administration. Be aware that some peptides need to be cycled and need to be used for a certain period of time and then off. GLP-1 agonist, that's not the case. You're really on that fairly regularly. So question I was asking me in the past was, do you need to eat healthy and exercise when you're taking these kind of treatments? Of course, the answer is yes. That's how you get an optimal result. The peptides will help you improve your eating habits, will improve you metabolically, but you still need to eat healthy and exercise. Like you still need to do that for body composition and overall health purposes. Can these treatments, such as semaglutide and tirzepatide, make your muscles and bones weaker? So listen, when you're losing weight, your body is losing both fat and muscle. So the focus has to be on improving your body composition. That means doing strengthening or resistance exercises, optimizing your nutrition to maintain muscle and bone health, and combining with other peptides as well. Interesting question. If I was asking in the past was, if you already don't eat a lot, will these treatments still help? The answer is yes. Peptides work not just by regulating your appetite. They work because they improve your overall metabolic processing of food and sugar. In addition, lipotropics work regardless of how much you eat. So the peptide treatments are still helpful, even if you're someone that doesn't eat a lot. Maybe you don't need as high a dosage. Maybe it's a lower dosage to improve things metabolically for you. Another question, if you stop the treatments, the peptides, will you regain all the weight? Studies show that if you stop the treatments, semaglutide, you'll regain about 2/3 of the weight loss is possible. Now the key is if you maintain good nutrition, exercise, that'll help to maintain your overall weight loss. And then the other thing is, when it comes to using these treatments long term, these peptides are made for long term usage as well. And so you should consider that if you need assistance with weight loss and metabolic health, that you're taking these for the long term, and that can be for years. And the data shows that taking these for years seems to be safe at this point. And now we have data that's going 4 to 5 years out, and it seems to be low risk and safe. And then how do peptides compare to other prior weight loss meds? Look, the peptides lead to more reliable weight loss compared to the prior meds, and they're dramatically safer than the prior weight loss meds. And so really that sort of risk and benefit profile is fantastic for the GLP-1 agonist in comparison to some of the older weight loss treatments that were available. So just a little bit more about our Physician Assisted Weight Loss Program. Starts with thorough evaluation. Make sure you're an appropriate candidate based on your history, weight loss goals, any other underlying health conditions. Managed by myself and my team under physician management, under guidance. Continuous monitoring and adjustment of your treatments as needed on a monthly basis, with regular lab monitoring, scheduling your labs every 6 months to make sure things are done safely as well. So our overall program, which combines peptides and lipotropics, is listed below. The peptide therapy start at $450 per month. The lipotropics start at $150 per month. This includes the medical monitoring, the medication, the supplies. It's not the labs. That goes through your insurance anyway. To learn more, to join our weight loss program, you can see our QR code there. You can also go to our website under the peptide therapy section and learn more as well. Great. Let me check to see if there's any other questions from any of our social sites as we're streaming live there. Great. Well, listen, everyone. So peptide therapy for weight loss, for metabolic health is such a great option. We're seeing a lot of benefit in terms of not only weight loss, in terms of pain relief, in terms of reducing inflammation, improving overall metabolic health, an exciting new way to help folks out for not only treating some of their active current metabolic, immunologic pain issues, but also exciting and possibly preventing a lot of the kind of things that poor metabolic health lead to long term as well. If you'd like to learn more, check us out at chicagoarthritis.com. You can give us a call, email us, contact us through any of our social sites. You'll get a copy of this webinar after we're done if you'd like to rewatch or share with any other friends, colleagues, or family members. And we're here to help. We're here to answer any questions. And if you'd like to learn more, contact us at your convenience. And until we connect again, have a good day and live well. Bye-bye.